Hi, everybody. Tonight we're going to talk about quality in healthcare. Now, when I say quality, you probably think of something that's well made, that's durable, that is good value for the money, that lasts a long time. And in healthcare, those things are true, but we have very specific definitions that we'll be talking about tonight. So we'll talk a little about the concept of quality and a couple of key frameworks for quality in healthcare. We'll talk about how the quality of the overall healthcare system in the US is measured. We'll describe how the quality of healthcare plans and hospitals are measured in the US. And we'll discuss the concept of accreditation and how that relates to quality. Now, the Institute of Medicine was instrumental in defining healthcare quality in the United States and globally as well. It defines healthcare quality as the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge, which is a fancy way of saying that the health services provided are provided in an evidence-based way, and that when we provide those services, we increase the chances of people having good health. Now, the report this was published in, um, the Crossing the Quality Chasm, a New Health System for the 21st Century, was one of these foundational reports that had an outsized influence on how we view quality, even through till today. Now, in this report, in addition to talking about the overall definition, the Institute of Medicine said there are 6 domains of quality. And the first domain is that it's safe, that it avoids harm to patients from the care that's intended to help them. So an example would be in a hospital, ensuring that patients get the right medication and not medication made for someone else. This is why today, if you or someone you know has been in a hospital, um, every time they come in the room, they ask, what is your name? What is your birth date? Before you are given medicine. They could have asked it 2 minutes ago. They'll ask you again, what is your name? What is your birth date? Before they take you for procedure. Because what they're doing is they're checking to make sure that the name on that medicine is the same as your name so that they're not giving the medicine to the wrong patient. They're keeping you safe. Now, quality, another domain of quality is effective, which means quality care is based on scientific knowledge. It's evidence-based. It's provided to all who could benefit from it. And this is really important. It's not provided when not necessary. So quality care is not over testing. Quality care is not over prescribing. For example, quality care is not providing antibiotics for viral infections, even when people insist, because antibiotics are useless against viruses. Quality care is patient-centered. It's respectful of and responsive to individual patient needs, ensuring that patient values guide all clinical decisions, but while ensuring that it's still based on scientific knowledge. The words culturally competent, culturally humble were not really part of the lexicon in 2001, but this is the core of what patient-centered means. Now, quality care is timely. It reduces waits and delays for both patients and healthcare workers. People get the care they need when they need it. Quality care is also efficient. It avoids waste, including wastes of equipment, supplies, ideas, and energy. And finally, quality care is equitable. It's care that does not vary in quality or quantity because of personal or community characteristics, so that everybody with the same medical need gets the same quality of care, regardless of their insured status, regardless of their zip code. Now, the World Health Organization also has a definition of quality that very much leans on the Institute of Medicine's definition. So the World Health Organization defines quality of care as the degree to which health services for individuals and populations increase the likelihood for desired health outcomes. And again, they talk about it being based on evidence-based professional knowledge. The World Health Organization has a great website about quality of care. This is one of their infograms. They have one to break down the concepts for everyday people, and you can go check it out on their website. Now, who started this quality movement? A lot of times in healthcare, in many scientific fields, we just accept things as common knowledge, as if they've always been there. But these ideas didn't come to us from the cloud. They didn't descend. Real human beings came up with them. Avitas Donabedian, Professor Avitas Donabedian, is the founder of empirically studying the quality of healthcare. He was at the University of Michigan. In 1966, he wrote a paper. It was reprinted in 2005 called Evaluating the Quality of Medical Care. And he was the first one to really think about healthcare as a system. And he defined quality, in short, as the degree to which healthcare provided adheres to current best practices. And you can see that definition in the IOM definition, in the WHO definition. But who was Professor Donabedian? I won't read all of this, but I do want to hit some highlights. Professor Donabedian was born in 1919 in Beirut, Lebanon. As a child, he moved to a small town near Jerusalem after his family fled the Armenian genocide. He was a Christian with Jewish, Arab, and Christian friends as he was growing up in Palestine. He earned his medical degree from the American University of Beirut in 1944, and he worked in both Jerusalem and Beirut as a primary care physician until 1954, when he moved to Boston to earn an MPH, just like you guys are earning an MPH. He became ultimately a professor of public health at the School of Public Health at the University of Michigan, and this is where he did his groundbreaking work. One of the things I love best about Professor Donabedian is that he was a poet and that he had a warm heart. And if you go down to the end of this, this is a one of his many obituaries that I condensed for us. You know, he stated that systems awareness and systems design were important for health professionals, but that these alone were not enough, and that it's the ethics that matter. And he says, ultimately, the secret of quality is love. Just think about that for a second. We don't really talk about love in this class. We don't talk about love in the MPH program. And yet the founder of the quality movement talks about love. And he says, you have to love your patient. You have to love your profession. You have to love your God, or supreme being, or higher power, if we were to put it in modern parlance. If you have love, you can then work backward to monitor and improve the system. Just sit with that for a second. He also had a very practical way of measuring quality. So Donabedian's triad basically said that we could look at a healthcare system in three pieces. We can look at the structure, we can look at its processes, and if we know these two things, we should be able to say a lot of things about its outcomes. So what does this mean? The structure of a healthcare system is all the stuff that's there before a patient arrives. It's the organizational chart. Who's the boss? Who answers to the boss? How is the organization structured? It's the people, the physicians, the nurses, the nurse-patient ratio, the aides, everybody, the administrative assistants. It's the equipment and technology. It's everything that's there before someone walks in. It's the physical space. For example, the number of beds in the emergency room. Then he said, well, there's the process. What's the process? Process is all the interactions between the patient and the provider or the facility. It's what the patient actually receives. So, for example, one measure of process would be the percent of women who receive pap smears from their primary care provider. Processes should be evidence-based and adhere to best practices as they're currently known. Processes also include satisfaction as well. Now, the outcomes are clinical, are client perception or satisfaction, because satisfaction is a product of the interaction between the provider and the patient. And Donabedian included financial outcomes, because a healthcare system that leaves people bankrupt, as does our system for a substantial number of people with bankruptcies in this country, have them because of medical bills. So a healthcare system that leaves people bankrupt or impoverished is not a quality system. And so he included that as an outcome. So let's switch gears and talk about quality assurance in the United States. What is it we do in the United States to assure the quality of our healthcare system? A huge player in this is the Centers for Medicaid and Medicare Services, because they are the single biggest payer to healthcare providers and healthcare institutions, such as hospitals and laboratories and nursing homes and rehabilitation centers. They have a huge quality program and they keep track of many quality indicators. They also have a website that might be of immediate interest to some of you, which is a Care Compare website meant for consumers. So you can go on this website and you can compare the quality of different hospitals and look at their outcomes. You can look at the outcomes of physicians of lots of different parts of the healthcare system. It's kind of fun to explore. You can see how your healthcare provider stacks up. How else do we do it? We do quality assurance via accreditation. In the United States, there are numerous accrediting agencies. They're all nonprofit. These 5 are among the top 5. So most of you have probably heard of the Joint Commission for Hospital Accreditation, which is now just called the Joint and accredits other healthcare facilities as well. There's the National Committee for Quality Assurance, and their focus is on health plans and managed care plans. There's the Utilization Review Accreditation Commission. They focus also on health plans and accountable care organizations. There's the Commission on the Accreditation of Rehabilitation Facilities, and there's the Accreditation Association for Ambulatory Care. And so you can think things like freestanding surgical centers. Now, all of these agencies, here's some more information about them. I'm not going to take you through all the details, but you can come back to the slide and explore it if you want to know how many organizations they affect and what they do. You can also go to their websites. So why does accreditation matter? Why do we care? First, it's essential to many contracts. Remember we talked about the healthcare system, that most of the money goes to insurers, and then from insurers it goes to providers through a payment mechanism. Well, insurance companies, part of that payment mechanism is they have contracts with each and every provider that they work with. So every provider that takes your insurance, they have a contract with that insurance company. A lot of insurance companies will only contract with providers and healthcare facilities that are accredited. Again, very likely to be a condition of reimbursement. Accreditation may also fill state regulatory requirements. So in order to operate a hospital or a freestanding surgical center or a primary care clinic, one has to be, they're regulated by the state. They have to be approved by the state. Accreditation helps with that approval process. They can provide deeming status for Medicare and Medicaid. This is really critical, and we'll talk about this. They may reduce liability insurance costs. They're also a mark of quality for patients. If a patient knows that a center is accredited, it provides them some assurance that there's an outside agency examining the center. And finally, they provide assurance that the organization is current with healthcare regulations and they support continuous quality improvement efforts. Because as healthcare organizations and healthcare providers seek to accredit, they do a self-study, and this can help them discover things in their own processes that need improvement. So let's talk about deeming status. This is one of the main reasons accreditation matters. Remember, Medicare and Medicaid combined are the single largest payer in the US. They also have contracts. Each and every provider and healthcare organization and healthcare facility that accepts Medicare and Medicaid has a contract with them. Getting deemed status allows those providers and organizations to be considered compliant with participation requirements, meaning they can get paid by Medicaid and Medicare. They can be deemed if they're accredited by one of those agencies that we talked about. The accrediting body's certification serves as proof of compliance, and thus the organization is exempt from having to go through the Medicare and Medicaid survey and certification process. Medicare and Medicaid centers, the CMS, heavily leans on the accrediting agencies in order to deem or approve the providers that they will pay. So let's take a deeper look into two of these just to give you a sense of how it works. So the National Committee for Quality Assurance is a nonprofit, been in business since the 1990s. This is when health maintenance organizations started to really take off. It was a little bit the Wild West then. And so they came into existence to essentially monitor and assure the healthcare quality provided by healthcare organizations. And they've since expanded to other health plans, to accountable care organizations. They're a voluntary process. And the reason I put that in quotes is without accreditation, you can't get paid by Medicare and Medicaid. So almost all, you know, HMOs and other healthcare plans are accredited. So how do they accredit? They use something called HEDIS clinical quality measures. And what is HEDIS? Stands for Healthcare Effectiveness Data and Information Set. It's basically a set of healthcare performance measures. It's the most widely used set in the US, and it's based on data from the previous year. They also use a survey called the Consumer Assessment of Health Providers and Systems, which is essentially a patient satisfaction survey about different healthcare facilities. So what do HEDIS measures look like? HEDIS measures are process measures. Remember, quality is the extent, right, to which healthcare organizations and providers adhere to current best evidence-based practices. So one HEDIS measure, if they were accrediting a healthcare plan, will be how many adults in the healthcare plan had a BMI assessment in the past year. How many adults who were age appropriate for it received colorectal screening cancer screening? How many women received cervical cancer screening? All of these measures, and there's many of them, would all be collected in a self-study by the organization that was seeking to be accredited, and then they would be sent to NCQA. There's a site visit, and then if everything's in good shape, they become accredited. So now let's look at the Joint Commission. This initially started as a nonprofit in 1951 for hospitals. In the 1950s, there was a large expansion and construction post-World War II boom of hospitals in the United States. The Joint now accredits other types of healthcare organizations as well. About 82% of hospitals in the US are Joint Commission accredited. There's about 5,800 hospitals. But overall, the Joint Commission accredits 19,000 healthcare organizations. They do a survey every 3 years to compare the practice of these organizations to their standards. And again, it's voluntary, but it's a hospital can't get deemed, can't get Medicare and Medicaid funds without this. So the Joint Commission for every type of center has standards. And they emphasize the organization system. So an ambulatory surgery center would take this book of standards and would be expected to complete a very large survey, a self-study, in which they documented how they provide care. So there's an annual self-assessment process. It's called a periodic performance review. And by doing this, the organization can see what they're doing well, where they're falling short, and they can engage in continuous quality improvement. Now, the last thing I want to talk about is how do we measure the quality of the overall US healthcare system? Excuse me. This is done through something called the Agency for Healthcare Research and Quality, or AHRQ. And they produce a report called the Annual National Healthcare Quality and Disparities Report. They look at the overall quality of care in the US. They've been doing so since 2003. It's legislatively mandated. Again, they're a quasi-governmental agency. Their report includes information on over 400 quality measures nationally about access, about quality, about equity. The data comes from over 45 sources. The specific indicators are selected with guidance from a working group of representatives from the different health and human services agencies. And the report focuses on a subset of the core measures. So they'll report all of them, but they'll focus on some of the core measures, and then they'll bring in information from other supplemental measures as well. And this report every year is released every year. What is it used for? It's used to make policy, it's used for quality control, it's used to determine what should be funded, it's used to do a lot of things. It's used by local, state, and federal authorities, it's used by private funders, and it's used by researchers. It tracks the progress or regression towards national and state health goals over time. It looks at geographic variations in healthcare. It identifies healthcare quality concerns, assesses health inequities, and it identifies areas where interventions are most needed. And that is our lecture for tonight. And I look forward to seeing you all in class.